Good evening, everyone. It's Wynn Brown from Heywood Healthcare. It is my Friday COVID-19 Heywood Healthcare update for everyone. Appreciate you taking a look at the video. Just an update, I always start with testing. We have tested 107,280 specimens, 101,557 negative, 5,285 positive, and 132 indeterminate. The real story is that we've ticked up on our overall cumulative rate to 4.9% versus the state at 2.8%, and our 7-day rolling average is at 9.14%, trending down about 0.5%, but still well above the state at 1.88%. So when you watch the news and they talk about the trends going down, we are an outlier in our region, and so everybody needs to know that the Delta variant is alive and well, and you need to be paying attention to it, even if you're vaccinated. And if you're not vaccinated, you need to go to CVS or Walgreens and get vaccinated and just get that done. I know there's a lot of people think that they don't need to do it. The trouble is you're also exposing a lot of kids to it, and the number of adolescents that are coming through positive every day is crazy, and that's because the adults around them aren't vaccinated. So I know that this falls on deaf ears for a lot of people because they are non-believers and whatever, but you're riding off of the herd immunity that myself and my friends and colleagues who are vaccinated will be much worse if we weren't vaccinated. So if you're a grandmother or a parent, grandfather, influence the younger generation to get vaccinated and get that done, and this would all disappear. Okay, lecture's over for now. Now you know how my kids feel. At Heywood, we have 9 COVID positive inpatients that we are caring for. That is down from our high of 16 last week, but it does a little of this along the way. And there's a graph here for you to see our community prevalence by town. You can see it seems to be turning in a favorable direction, but again, we still outpace almost all the Commonwealth. So just an update on our education connection. So if you want to know what to do while you have COVID-19, there's a link there. There's a Facebook video link as well. And the 10 things you can do to manage your COVID-19 symptoms at home. So please take a look at that. We are surveyed all the time by federal and state survey groups and the state and the federal government to make sure we're doing a good job. We had a Mammography Quality Standards Act inspection at Athol this week. So the Department of Public Health came in and congratulations to Lisa Berry and Michelle Munger for well job. Our mammography survey was 100% compliant at Athol. So just showing you that in the midst of all this, we continue to do a good job and we are in compliance with all state and FDA regulations. So kudos to our imaging staff at Athol, but also at Heywood as well, and also at our urgent care centers. They do a fantastic job and make sure they're on top of everything. A reminder that this is October, National Domestic Violence Prevention Month, and we continue to host Central Mass YMCA's Empty Place at the Table. We have 11 plates of the names of women lost to domestic violence in Massachusetts this year, and there's a link there for you to click on, and you can see our setup, which is really fabulous. We had our Stepping Out for Service Star. We had 2 of them this month. Last week we honored Roxy Howe, who is a CNA on Watkins 1, and thank you for a job well done. And Nora Salavardos presented that, and you'll notice, community, that Nora is our Chief Nursing Officer, and she is in scrubs. She's not in her typical business attire. Why? Because she's on the floor working. We have an incredibly high census. We are short-staffed, and our Chief Nursing Officer is stepping up and working on the floors and in the ER to make sure that you are well cared for. That's the kind of work your community hospital does. So a shout out to Nora as well. We also honored Evelyn Hastings, a longtime EVS staff member and quiet leader within our organization, for a job well done. So we have a picture of that as well. And just a CNA shout out. So Roxy Howe just shows you how great she is. Took time to write a note to Dr. Hurley to thank him for helping her reposition a patient and for his kindness to both her and the patient. So a great shout out, and shows you how the family works when you're at Heywood. It's also Emergency Nurses Week, so we've got some pictures of our emergency staff, and they're here, the heroes among us. It's also Ultrasound Awareness Month, so those of you who get an ultrasound know it's important because they they are really diagnostic medical sonographers, and they are very important to the care you receive, and we do an awesome job. So thank you for that. And it doesn't end. It's Case Management Week, led by Barbara Nealon, and those folks really make sure that our patients are supported and guided while they're in the hospital and as we transition them home. So thank you for our incredible team for that. And just every morning we meet in a huddle session. We used to do it in person in COVID, now we do it virtually, and there are about 40 to 50 managers and directors and VPs every morning on this call for 15 minutes to make sure that we're going around the house to make sure that we know everything that is going on, or if something's broken, something needs to be fixed, there's a ball that needs to be picked up. And so we recite this pledge every morning at the end of our meeting. Our pledge that we affirm is that we will provide Heywood Healthcare family, patients, and their families with an exceptional experience every minute of every day without exception. That's what Heywood Healthcare does. So if that calls out to you, please check the link below. We have a myriad opportunities to work inside Heywood Healthcare. Take a look at it. Maybe you have a friend or a family member who's thinking about healthcare. We have all sorts of jobs that require minimal training all the way up through being a physician with ultimate credentials. But there are so many pieces that come into taking care of patients, and we can create a great career path for you. So take a look at that. Our minimum wage starts at $15 an hour and goes up from there. As we continue our journey to be one of the best community-owned health systems in America, have a great evening.